Welcome to the City Current Show, powered by Hagen-Botham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Hagen-Botham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And that's why we're excited to be talking about Faith Family Medical Center. We're honored to have with us their president and CEO, Phil Ellenburg. Phil, how are you doing?
Jeremy, I'm doing great. Thank you for having me on today. It's a beautiful day outside, and it's a beautiful day inside as well. So couldn't be better.
Well, you and your team do amazing work when you talk about health, wellness, primary care, behavioral health. There's a lot to dive into. Let's start with a little bit of history, though. So give us some history for Faith Family Medical Center.
Yeah, Faith Family, thank you. We've been around for about 25 years doing primary care for the working, uninsured, and underinsured in Middle Tennessee. We got started with a dream from Dr. David Gaw, who wanted to find a way to help people, and that led to a lot of work, a lot of effort, and a lot of vision. And so we are right here in the middle of the medical corridor in downtown Nashville. And so we have just been working every day to help folks. It's day one. We had no one show up back in 2021 to today, where we serve over 3,300 individual patients, about 12,500 visits a year. So it's been a long journey.
Well, I know that the plan is to help even more. And when you look at the population you serve, it's growing. And so talk about the population you serve.
Yeah, so we serve the working uninsured. And so what we say pretty often around here is we serve all the people that make Nashville great. A lot of our folks are our hourly employees who work really hard but don't have the benefit of benefits, health benefits. So we're serving people in the construction industry, the music industry, the hospitality industry, restaurants, hotels. We serve people in the daycare world. We're serving people in the gig economy. Those folks, Uber drivers, whoever they may be, the people that are out there just really making all of our lives better, but they don't have the blessing of insurance. And so we do what we can to help them because they're helping all of us.
Talk about the model then, because when you talk about how you do it, it's innovative and it's creative.
Yeah, so we work on a sliding scale basis. Our belief is that everybody pays something, but nobody pays full price. We have found, as far as our outcomes go, that if people will invest in their own healthcare a little bit, we'll get better outcomes because they've got some skin in the game. So our sliding scale is based on income and number of dependents. The basic threshold is that somebody in the family works 20 hours a week. And then that sliding scale, which is $25 to $65, is based upon that income number of dependents. Our average patient is going to pay about $40 a visit, so about the cost of a copay for those that have insurance. It cost us about $240 for that visit. So just for scale and context to let you know, that's the nonprofit in what we do. There's our nonprofit right there. But very, very valuable service, but people feel good about paying something for their care. And we do everything we can. Our requirements are, they're not just suggestions, they are requirements, but we do try to make it possible for people to come. So we're doing everything we can to get people in the door and let them come and see a great medical provider.
It is primary care, but I love the fact that it's holistic. And so your team, very diverse in their skill sets and expertise and what they bring to the table. When you look at behavioral health, wellness, diet, all of these things that really go into a full life, start diving into the specializations, your team, and that holistic approach.
Yeah, so thank you. That really does kind of set us apart for what we try to do. We try to treat every person, body, mind, and spirit. We really can't separate those things when you're thinking about our wellness. And so we do provide great primary care. We have an amazing Chief Medical Officer, Dr. Parker Panovec, who oversees several nurse practitioners and physician's assistants that are full-time on staff here. And so we're an appointment-based organization. So whenever somebody comes, they're going to see their provider every time, same provider. So they get to know the patient, get to know their story. We have a little different model as well. Nothing against our for-profit friends out there, but when I go to the doctor, I'm lucky if I get to see them for 15 minutes. We do our appointments based on 30 minutes for returning patients, an hour for new patients. And a lot of that is based upon the fact when our patients aren't working, they're not getting paid. So we're mindful of trying to take care of them and learn their whole story so that we can do the best we can for them. A lot of times they'll present to us in worse condition because they put off going to the doctor because they don't have insurance. So we take that time with them. We get to know them. We do primary care. You mentioned our behavioral health. We have a full-time behavioral health nurse practitioner providing mental health services. Also, a lot of work in medication management, working with our patients and making sure that they get the medication they need, can stay on that medication, referring them to counselors if needed. A big part of what we do here also is that medication management, not just in behavioral health, but for all of our patients. So we've got a great relationship with Lipscomb University's College of Pharmacy. They run our patient assistance program. Almost all of our patients are going to qualify for free and reduced medications, but the paperwork for that is kind of like filling out the paperwork to buy a house. It's pretty extensive, can be overwhelming. Some folks don't speak the language that the paperwork is in. So the team from Lipscomb will come do the research and get that medication for our patients for $5, basically free, but for a $5 handling fee. So again, just for context, that because of their efforts, we provided about almost $5 million worth of medications to our patients last year for basically for free. So that's a big part of what we do. We also have a wellness center, which is really unusual for a primary care facility. Our wellness center, we call it Journey to Wellness. We're doing everything we can with our registered dietitians to teach patients how to live a healthy lifestyle. So we've got a demonstration garden where we're showing them how they can grow vegetables. If they have hypertension and they need to get off salt or other things for their diet, we can show them how to have still flavorful, healthy food. Whether they're growing it, whether they're looking for it in the grocery store. We also have a demonstration kitchen where we can teach people. We do cooking classes to show them how to cook fun food, healthy food. We do lots and lots of consultations with our patients to provide them with information about how to live healthier lifestyles, how to eat healthy, live healthy, whatever it might be, manage their diabetes, manage their hypertension. And so that wellness component is key. By the way, that is a free component to all of our patients. We make that available. We want them to have access to that. We do fitness classes as well, Zumba, yoga, chair yoga. We've done some self-defense classes. We have some exercise equipment. We're never going to compete with the Y with what we do here, but we're teaching our patients how to use that equipment. So if they go somewhere, they're not intimidated. They can walk right in. We all know what it's like to go to a gym and go, wow, everybody here knows how to do this but me. No, we teach them how to do that. Our patients that are committed to a walking program, we'll take them and buy them usually their first pair of really nice walking or running shoes through great folks like Feet Fleet and others. So anything we can do to help them live well. And so that's a huge piece. We also have a combo chaplain and community healthcare worker who does a lot of counseling for our patients, but also helps our patients if they don't show, for instance. He will reach out to find out what happened. Well, situation where we had a patient, I had to take 3 buses to get to the clinic. Bus number 2 was late. I missed bus number 3, couldn't show. So, we connected her with a special program through Uber that helps people get to their doctor's appointments. So just making those connections to lower those other outside barriers that affect everyone's health. I know I just gave you a mouthful of stuff there, but I'll pause and let you ask if there's anything I need to go back over. I just start going. I get excited and passionate about this. So
I love it. Well, and the fact that it's very personal. I mean, just like you're talking about, taking a personal invested interest in each patient and what they're going through. And just like you mentioned, the barriers that they might have to overcome and how do you overcome them? Yeah. And I also think too that, this personal approach that you're talking about, this holistic approach, it creates generational transformation, because when you're working with the parents and teaching them how to fix healthier meals, that carries into their kids. And so it's one thing to obviously treat an illness, but then when you talk about a holistic approach and how that can create generational change for these families, that's a powerful piece, I think, that creates a ripple impact in the community at large. Talk about vision looking forward, because as I mentioned earlier, you have plans to help even more. And so talk about what the vision is moving forward.
Yeah, so we're blessed with we still call it a new facility. We moved into a new facility in the middle of the pandemic in July of 2020. But we went from about 3,700 square feet of clinic space. Now we've got our first floor is 8,500 square feet. It's all clinic and wellness. We have a second floor. So we've got room to expand. And what we want to do is do everything we can to increase our presence and serve as many patients as possible. There's a big number, it's over 200,000 Middle Tennesseans who are uninsured or underinsured and working. And so we're just trying to make a dent in that. So the immediate over the next couple of years is to fill this building, but we're already we've just adopted that plan, but we're already looking forward to see where are those areas outside of Nashville that don't have access, that need more access to primary care, and looking to launch places that we can go and meet our patients where they are and make it easier on them. So it's really just a matter of trying to get the word out to let people know, number one, we're here. People tell me all the time, wow, you're the best kept secret in Nashville. And that really just drives me crazy. I hate to hear that. We don't want to be a secret. We want people to know we're here. So getting the word out, and we have the space to serve more patients. So we've got a pretty ambitious plan over the next 5 years. We can serve 85% more patients in this facility. So we've got a growth plan to do that. And it's not about, this is not a growth for dollars' sake. We lose money on every patient. This is a growth for our mission's sake to serve our hardworking neighbors in need. So that's what we're all focused on right now, is doing everything we can to get more people in the door so we can help them.
Obviously, the community then can help by spreading and raising awareness, so spreading the word.
Sure.
But also, too, as you alluded to, that gap. And so financial contributions play a very important role in fulfilling the mission. Talk about the many ways the community can support your efforts.
Yeah, so I appreciate that. We do. We fundraise 70% of our budget every year. And so it is a pretty heavy lift. And so multiple ways people can support us. Number one, letting people know if I don't know how many conversations I've had with people serving my food in a restaurant, cutting my hair, which is a pretty easy job these days. Quick, not a lot up there, but somebody that I meet that's on a construction crew, just spreading the word about, hey, if you need a primary care home, Faith Family. So that's the first thing. Second thing, we have volunteer opportunities, whether people are in the medical space. We have a lot of volunteer nurses. We have volunteer MDs in specialties that come serve our patients. So if you're a doctor hearing this and you're looking for maybe what's next, hitting retirement, come talk to us. But frankly, when it boils down, our biggest need is just is funding. And so we're just looking for partners who can walk alongside us. Every dollar helps. We're proud of the fact that our auditors tell us that 85 cents on every dollar donated goes directly to our mission. So we're not spending, we're a lean organization, and we're spending it on things that help our patients. We can take about every dollar given, we can turn it into about $4 worth of health care. So if you're an ROI person, that's a pretty good one. We save our local ERs over $8 million a year by treating patients who would otherwise go to the ER for their primary care. if we can reach them ahead of time and let them come here, then they're not going to go to the ER. It also helps the ER so that they can see the more critical patients. So a lot of things that we can do, but if that is something that interests somebody, we need help, frankly, with funding. The medical community is really good to us here in Middle Tennessee. They're very supportive, but I'm always out there, looking, shaking hands and saying, hey, can you help us? We've got events, if people like that. We've got a golf tournament, actually, that's coming up on June 9th out at the Hermitage on the beautiful President's Reserve course. So that's a good way to have fun, but also support a wonderful organization. And then our signature event every year is in the fall. We have what we call the annual birthday breakfast, where it's a traditional event, kind of gala, but instead of being in the evening, it's in the morning. It's going to be at the Country Music Hall of Fame this year on September 17th. We already know the date. So those are some concrete ways to do it, but we're just looking for partners to walk alongside us. One thing I'll say, if anybody's interested, I guarantee you whatever you might be thinking in your mind of a free and charitable clinic is probably not what you're going to see if you come visit. I love nothing more than giving tours to people to show them the amazing work that our team does. So anybody wants to come down, we'd love to do that. And then usually when people see what we do, they say, how can I help?
Yeah, absolutely. We'll wrap up with where can we go to contact you? So where can we go to, find more information to get involved? Website, social media, phone number, where do we go?
Website, faithmedical.org. The website has everything there. We've got great information, great testimonials from patients, videos, but also ways to get involved. We're on LinkedIn, we're on Facebook, we're on Instagram. So you can find us on all these places, but check us out. And we'd love to tell you more.
Website again, faithmedical.org. So Phil, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Hey, thank you so much. It's been a real pleasure.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.